The full program has 34 sessions for children, and in general, in the early work, these were all done in group, although we've done some recent research where we found that if you could deliver the same program one-to-one, face-to-face, and get at least as good of results. In fact, in one certain way, it can even be better. But it could be delivered in small group, could be delivered face-to-face. Typically, these are weekly meetings, 45 to 60 minutes a session. If it's in a group, 4 to 6 children, ideally. And if we have 6 children, we'd like to have probably 2 leaders, if possible, so 2 co-therapists, because these are children who are going to engage in limit-setting behaviors, and it's a good idea to have a second therapist helping. So in a lot of the work that we do, the second therapist might be one of our graduate students or a trainee who comes in and helps in the work. Yeah?
Does the sex of the therapist matter, like to be one man or woman?
We've not found that it matters. Now, I think in general, although I think so when we do this kind of screening, there's about 2/3 of the sample will be boys. So more boys show up as being overtly aggressive than girls. And I think for some boys it does help if there's a male therapist. They can identify more. And I think the flip side, maybe even more so, if it's a girl, I think having a woman therapist probably helps. So I think if it's possible, if you have a mixed gender group, boys and girls, you might want to have a male and female if you could. But I also think if you don't, actually I think it's not a very strong effect. I think it's a mild effect. I think the key thing, and I'm not going to talk about it much today, but I'll talk about it a little tomorrow, later, actually today, is that clinical skills make a difference. And I think that's a much bigger deal than gender. So we have evidence from videotapes of sessions where we videotape groups, and we're looking at the therapist behavior. So therapists who are not as warm in the sessions with the child and who are more angry and irritable with the children have children who get worse over time. So a key thing, I think, is clinical skill in that way. And it's a big deal because, you know, these are groups that are, by definition, frustrating. These are children who don't comply. You know, these are, and so I understand that therapists can be frustrated with it, but it's important to have those kind of skills. I think that's more important than gender. We also, when we're delivering this in groups, we also often have periodic one-to-one sessions, so maybe once a month or every 6 sessions or so. And these can be brief. These can be 20 minutes or 30 minutes, but pretty brief. And we do that for several reasons. One is these are children who, within the group, can be difficult to manage. And so by meeting with them one-to-one, I can develop a stronger therapeutic relationship with them. I get to know them, they get to know me, and that can actually help in the process of the group. And it's also a way to help the children to generalize skills. So in the group, we're talking about how you could use these kind of anger management tools.